Hi.
Hey,
Like
Joan.
I said, could I please ask the question and then hang up? Because last time we were both talking at the same time, and I
Cool.
never heard the answer. So
All right, Joan, go for it.
this is my question. There's a 55-year-old male who's a waiter. So he's on his feet, and he had inserts made for his shoes from
Sure.
a foot doctor, I believe. But he has a pain from the back of his right foot, from the back of his little toe along the side, and he says it's very, very painful. And I asked him, well, is it a sore? What is kind of pain? What is it? He goes, well, it's like inside, and I don't know, but it hurts a lot.
Okay. Is that it?
That's it.
All right, Joan, why don't you go ahead and hang up, and now it's my turn. Okay, the differential diagnosis works something like this. When you have pain along the lateral aspect of the foot, if it's an acute issue, something that happened, and all of a sudden, bam, you have pain from the fifth toe to the ankle. Okay, what I look for first is actually an avulsion fracture of the fifth metatarsal. Okay, and if you're on your feet a lot, okay, if you're, we used to see these in the military a lot when people go on a march. Okay, you'd end up with a significant number of people that would come in with foot pain that would have an avulsion fracture along the lateral aspect of the foot. And the way that you find this easily enough is you hold the foot from the bottom. Okay, if it's his right foot, you would use your left hand, and you hold what you used to call the toe box when we sold shoes, right? Okay, the middle finger is going to rest right on this metatarsal. Okay, if that's the point of maximal tenderness, then he needs to be put in a boot, because it needs to be immobilized, because it's a fracture and it will heal. Now, what else can it be? Okay, there's a nerve called the intermedial-dorsal branch of the fibula that can cause this pain also. And it's caused by an entrapment of that nerve as it passes over. It splits, actually. A branch goes under, a branch goes over. Something called the extensor retinaculum, which also gets worse with standing for any length of time, in particular if the ankle swells. Okay, now, could it possibly be something called sural neuropathy? And the answer is yeah, very, very unlikely. Usually the pain there is behind the ankle. Typically it's bilateral. But my suggestion to him is to make sure that he doesn't have an avulsion fracture. Why? Because if he does, you need to take action on it. He needs to put it in a boot. It needs to be rested, which means as a waiter, he's going to be walking around kind of like, Fester and Gunsmoke way back when. But it does work, and he may need to put it in a walking boot. But if that's the case, that's what you do. Now, what can you do in terms of discomfort? Typically, you go topically. I prefer to use my own product called Kink Ease because it's cheap. But if you have unlimited budget and an insurance card, sometimes Voltaren gel works better, but the best stuff out there is Pensade, which is a 2% Voltaren and a DMSO base, and it blows through right into that joint and settles it down pretty darn quickly. So, Joan, that would be my answer, and I hope you had a pen and you know how to take notes.